Hello guys, welcome back to the channel. It's Unit 8 Part C. Today's topic preterm birth. Preterm birth is nothing but normally the birth of the baby occurs in around 40 week. But if the birth of the baby occurs before 40 week in the midway, that is around 7.5 months, that is before 37th week of the pregnancy, that is considered as preterm baby. Then in preterm labor, generally the position of the baby is breech position. The causes of this is if there is any infection in the uterus, any placental conditions like placental abrasion or placenta previa, if the cervical muscle is weak, if there is any rupture inside the muscles or membranes, multiple pregnancy, that is two or more babies, if the baby is dead inside, intrauterine death can lead to preterm birth. If the fetus has any abnormalities or the female, that the woman has any abnormalities in the uterine, then doctor generally advises to undergo preterm birth. Genetic factors can lead to preterm birth, and any underlying disease condition like hypertension, diabetes, um, thyroid can lead to preterm birth. Apart from this, your lifestyle, the way you live, like if you are smoking or you are living in the smoking environment, if you are living in the unhealthy environment, can definitely affect the growth of the baby and lead to preterm birth. These are the causes of preterm birth. Management of preterm birth. In this, the first thing is to prevent it. How we are going to prevent? When the woman's pregnancy is confirmed, we will advise her to come for a routine checkup or the weekly checkup. At that time, we will take her vital signs, the whole measurements like her height, weight, how the baby is growing, is there any defect or not, like ultrasound will be performed, fetoscopy will be performed, fetus heart rate will be heard. If there is any defect or any condition that is indicating that the birth of the baby may occur in the preterm, we will provide medications and treatment to stop it. Generally, by good diet, good lifestyle, we can stop the preterm and lead it to the full term birth. If this preterm measurements has failed and preterm delivery is occurring and still there is a chance to stop it, like to we can arrest the preterm birth, that is done by giving a complete bed rest. We will advise the mother to not move at all, to be taken full rest. Mainly, there is no action in the lower abdomen. Generally, we will advise the mother to place her leg in the 45-degree upwards. With the bed rest, we will give a drug called a stocholytic drug. It is a drug which stops the uterine contraction. If there is no contraction, then definitely the birth will be stopped. Even this condition is failed and the birth has occurring, that is the labor is started, then at this condition we will manage the labor, and this management of labor is generally done in two stages, first stage and second stage. We will discuss it now, and after the birth of the baby we will give care for the baby in the NICU. Management of preterm labor. In this condition, we will make sure the mother and the baby is healthy, and in the delivery process the baby has no any injury. We will make sure that conditions first. And in this, if you see, birth asphyxia is the common condition seen. We will try to prevent it. In the first stage of labor, we will try to stop it by giving the bed rest, and you already know it. Apart from this, if there is any condition in the mother that normal delivery cannot occur, then we will undergo C-section, and the whole delivery process, whole labor process will be noted down for the further health purpose. Like for in the next delivery, we will get to know for at what condition the preterm occurred, so we can prevent it like that. In the second stage, if you see, the delivery has progressed, and we will make sure the delivery is very slow and gentle to avoid the injury in the baby. Episiotomy is not really necessary because baby is not really large in size, but it is provided here to avoid the compressions or any injury to the head. Since the baby is not fully developed, so even a small minor mistake can lead to head injuries, small compressions can lead to head injuries. To avoid those things, we will perform episiotomy. After the birth, we will provide as usual normal care, that is clamping the cord. And if you see hypervolemia and hyperbilirubinemia or the common conditions seen in this preterm baby, we will try to prevent it. And after the birth, we will provide the care to the baby in the NICU section. This is all the management seen in the preterm labor. Questions will be provided at the end of the chapter. Until then, stay tuned. Bye.